You've decided on an IUD. That's awesome. They're over 99% effective at preventing pregnancy. They're long-lasting and low maintenance. But as you've seen all over the internet, the insertion can kind of suck. Dear Nikki, what can I do for IUD insertion pain? Here's what can help. Take ibuprofen or naproxen before your appointment. 600 to 800 milligrams of ibuprofen or 220 to 440 milligrams of naproxen, and it can really help with cramping after the procedure. But it doesn't do much for the pain during the insertion itself. For that, ask for a numbing injection. It's called a paracervical block, and it's now recommended as a standard of care. It can make a huge difference. They can also use lidocaine gel or spray, which can be applied to the cervix. You could also consider a cervical softener, such as misoprostol. Then, you want to really focus on how to best manage your anxiety. When we're anxious or tense, pain feels worse. So try listening to music, taking deep breaths, or ask your provider if they can send in a one-time anti-anxiety medication, like a Xanax. If you do that, just make sure you have a driver. You could also ask about laughing gas because some clinics offer that to help you relax. In certain cases, sedation or anesthesia can even be an option too. And it could be good, especially if you have a history of trauma or severe anxiety. Also, don't forget the aftercare. Mild cramping is pretty common for hours or even a couple of days. So use a heating pad, take a warm bath, keep on that ibuprofen as needed. And what's really important is make sure you're talking about your pain management before you get to the time of your IUD insertion. If your provider isn't giving you pain management options, then find someone else who will. This is Dear Nikki, and we'll be here every week over at the Gander to talk about things that matter.